Happy resumptions to you. My name is Mrs. Olaiwola, as you all know. This semester, I'll be taking you NSC 403, which is Maternal and Child Health 1. And this lecture will be an introductory lecture for the course in NSC 403. So that will be an eye-opening lecture for you to know what the course entails for this semester. So everything about this course will be introduced with this lecture, and subsequently we'll now be picking the contents one after the other to explain. So what is the objective of this course? At the end of this course, the student should be able to discuss the anatomical and physiological changes that are associated with pregnancy and childbirth. Also, you should be able to apply knowledge of preconception in the care of women and their family. You should be able to describe normal pregnancy, labor, and puerperium. And also you should be able to talk about abnormal puerperium, abnormal pregnancy, and also abnormal labor. The objectives to continue. At the end of this semester, you should be able to discuss family planning method, including factors that affect acceptance and choice of family planning method. Now we have various factors that can affect the uptake of family planning. Also, at the end of this semester, you should be able to apply the knowledge and skills acquired to conduct physical health assessments, plan and implement care for the family with other healthcare providers, and also to discuss the role of nurses and midwives in the clinical area and also the community setting, including during immunization. The contents. This semester, we'll talk about the anatomy and physiology of male reproductive system. And you can see this image, which is showing us the anatomy of male reproductive system, especially both the internal and also external structure of male reproductive system. You can all see that this is the penis, this is the scrotum, the urethra that contains the urine, the pubic bone, the vas deferens, the bladder, seminal vesicles, ejaculatory duct, and all. Also, we'll be talking about fetal development. How do fetus develop? We'll also talk about a review of history of midwifery practice in Nigeria and also worldwide. How do we start midwifery practice in Nigeria and also in the world? This course again will talk about the ethics and legal issue in midwifery practice. The contents to continue, we'll talk about the maternal and child health from conception to delivery and also post-delivery. We'll also talk about nursing care of mothers, the newborn, and also the family. Talk about the drugs that is used independently in midwifery practice in the world and also Nigerian as a case study. We'll talk about pain management in midwifery practice. We'll talk about the pharmacological management of pain in labor, also the non-pharmacological pain management in labor, where we'll be talking about music therapy, the TENS therapy, also aromatherapy. Also, we'll be talking about how to monitor the labor when the patient is in labor. We're using the new adopted method by WHO and also NMC of Nigeria, which is labor care guide, to monitor the progress of labor. And also, we'll be talking about the mechanism of labor. And here, when we are talking about the mechanism, we have different mechanism of labor depending on the position, the presentation of that child, and also the position of the child. We're talking about the normal mechanism of labor, where we'll be discussing the left occipital anterior, also the right occipital anterior, and right occipital anterior. Also, we'll be talking about the abnormal mechanism. We'll be talking about the OPP, where we have long long internal rotation and also long external rotation. We're talking about RSA for a baby that is presenting with breech. Now we're talking about the left sacral anterior and left sacral anterior. So under the mechanism, we talk about descent, the lie, the engagement, the altitude, the position, and all sorts. The content still continue. We'll talk about theories that apply to midwifery practice in Nigeria and also in the world. We'll mention the basic concept of midwifery practice, the standard nursing language and nursing profession, and also midwifery, where we are talking about the parity, the gravidity, the number of live births, the preterm, and all sorts. Also, we'll talk about the legal aspects of HIV, because in some you have an ethical dilemma. And when we are talking about ethical legal aspects, we talk about confidentiality, how to keep a patient confidence, a patient information confidence, irrespective of a relationship or anything. We'll talk about the ethical legal aspects, the informed consent, our counseling skill, and also mainly confidentiality. Also, we'll be talking about the quality of care in midwifery practice. In this quality of care, how can we provide care for a woman during pregnancy, during labor, during the puerperium with quality, with reassurance, and respective maternity care? We want to talk about how we are going to deliver our care to the patient with high level of dignity and also respect without disrespecting the integrity of our patients. Also, we'll do an overview of family planning and also newborn care. We'll be talking about family planning this semester, what family planning is, the history of family planning, the major types of family planning that we have. You can see that these are examples of family planning commodities. This is showing the copper T, this is the male condom, this is the oral contraceptive, and this is talking about the natural method of family planning, where we use thermometer to monitor the basal body temperature to detect the safe and the unsafe period. We'll talk about the newborn. Who is a newborn? And we'll talk about the coping mechanism of a newborn and also their reflexes. How to assess the newborn physically from head to toe, and also the neurological assessment. What are the teaching skills? This semester, we'll be teaching our teaching method, still maintain our lectures method, be doing some case studies, also group discussions. Our practicals will be through patient simulation and also when you are in your clinical postings. And also our online modules that will be downloaded for our patient, for you to read, and also the interactive section. The assessment method. We know that from the beginning of to the end of the semester, a student will be assessed, and the assess will be based on both the formative and also summative. So we'll start. The assessment will be from quiz, exam, case study analysis, group presentation, written assignment and reflection, and also clinical practical. So I wish you all the best in this semester, because this semester is load and packed. But I know that it will be an interesting semester. Thank you.